Finish up your orange juice, Zeus. Orange Zeus.
Hello, everyone. Thanks for joining us on our media briefing for today, the day before Christmas Eve day. So happy holidays for those of you who celebrate. We've got quite a few things on our list today, so we're going to go ahead and get started. I see that we've got Krista Honey on the line, and I'm not sure, is Rosemary? There's Rosemary too. So Krista Hani and Rosemary Soto are going to give us an update on the community health worker pilot project to date. Hello, ladies.
Good afternoon to you, May, and everyone else on the line. Rosemary will start us off, and I'll pitch in partway through.
Great. Hello, everybody. Thank you for your time. We are starting off, as you know, the pilot project for the community outreach was recently supported, adopted, and funded by the Board of Supervisors just this Tuesday at the rate of $4.9 million. And within that includes the hiring of about 100 community health workers. And there may be the possibility of expanding on that with some of the leveraging of resources and funding that might happen a little further down the line. But at this point, we have already implemented some of the strategies for outreach and community engagement, including having a presence at testing sites with some of our CHWs, our partners, including Building Healthy Communities and Center for Community Advocacy, others that we can include in the chat as a list. They have all begun to do a lot of the work that connects to this specific pilot project. Mind you, I have to emphasize that many of these organizations had already been doing a lot of community outreach and education and information dissemination since the pandemic began, but this will now support and augment some of those efforts. And the strategies that are being used are including having a presence at the testing sites where people are being offered and connected to resources while they wait for results. And we are also utilizing other strategies such as community engagement through social media, through their own pages, as well as in different community groups that might have discussions or might be open to initiating discussions around the pandemic and prevention and education. We also have a phone banking strategy that many of our partners have already launched on as well. Just having those phone calls, check-ins with the community members, with farm workers and others, distribution lists that they might have, but as well as we'll be tapping into other phone banking phone lists that we would be able to use through PDI, which is the Political Data Inc. That's one strategy that we'll be launching on as well. And we also are seeking partnerships with other existing community health worker efforts that are focused on perhaps other areas of health and making sure that we're having those connections there. And we've also initiated some partnership opportunities and discussions with Clínica de Salud del Valle de Salinas, as we know that they, as well as perhaps other clinics in the community, also hold testing sites so that we can make sure that we are expanding and growing our effort to its fullest potential and making sure that we reach all of the census tracts that have the most impact. And I'll also share the floor with my colleague, Dr. Hani, if there's other points that you'd like to add.
That's great. We definitely have had a really good and quick start. In our proposal, we had some basic metrics, and we're developing and expanding on those. But one of them was that we wanted to reach about 300 people a week minimum. And we're at about quadruple that. One of our partners is the Alliance, Central California Alliance for Health, and they're also doing phone outreach to their members that are in the Healthy Places Index census tracts. And they're estimating about 1,000 people a week. At the testing sites, we're reaching about 600 people a week through the conversations that the CHWs have there. And then we've already had one platica with Líderes Campesinas. Dr. Moreno was our guest last night for that, and that had really good turnout of 45 people in the Zoom, and then it was live on Facebook, and that was in Spanish and English. We still have more training that we want to do. There's ongoing training, and as Rosemary said, as we expand and work collaboratively and align with other community health worker programs that are already out there, we'll be able to share with them the trainings that we've had, and then share with them ongoing trainings to, again, have that alignment and messaging. And then Rosemary, did you mention, we've got the door hangers. We've got to get out this week 1,000 door hangers that are going into a couple of the census tracts, again, that have our higher rates. And those are just talking about staying home for the holidays, not congregating, and where to get tested. And we have a QR code on that, so people can quickly scan and get to the list of testing sites that we have on our website.
Great. Thank you both very much for an update on this project, which I'm hoping we'll have you back after the first of the year with more good news about this. If you would stay on the line in case we have some questions for you, that would be great. And Dr. Honey, if you could stay on for our next topic. Katie Castagna from the United Way is on. One of the important pieces of information that the community workers are going to be doing is talking about isolating and being able to stay home when you're sick. And there's a stipend program that has been developed, and Krista and Katie are going to give us an update on that.
Yes. Katie, I don't, actually, let me get started, and then Katie will step in as she talks about how the United Way has really been an amazing partner to help get this set up with the staffing and the software that they do have. So this stipend program was, again, one that was approved from our CARES Act funding, and is to help people to self-isolate. And it is where we, oh boy, I just pulled up the Spanish, and I'm sorry, I'm not a good Spanish reader.
Stop swallowing your words.
Stop swallowing my words. Okay, are you having trouble understanding me? Okay, I will try to.
You may have been talking to someone homeschooling.
Oh. Okay, that's okay. I will try to speak more clearly. So basically, this stipend is for $1,000. It's a one-time cash stipend for people. They have to have a positive COVID-19 test result. We started on December 8th, so they have to have had their result received by December 8th or later. And we are working with several of our clinic systems. We have Clínica de Valle de Salinas, our Monterey County clinic system, and Soledad Medical Group. And if any of those clinics have their patients, they are processing the referrals. Then also for any of the Optum test sites or other places that people get tested, they can call our call center line, and the process of the referral starts there. And we'll collect the information from them and see if they're eligible. So there is eligibility criteria. Basically, we've reviewed it before, and I can go over it again if anybody needs it, but it is focused in the particular city zip code areas, again, that align with the Healthy Places Index census tracts. And then once they determine to be eligible, they just make it through their self-isolation of 10 days, and then they are referred to get the stipend. It's going very well. We have already had a total of 94 people that have been enrolled, and more, I'm sure, will be enrolled today as they process those referral forms. But Katie can talk about that sort of referral process and this great software that we have to utilize for that.
Thank you, Krista, and good afternoon, everybody. This is really an outgrowth of our work with the 211 information and referral system. And as you're aware, that's a centralized place where people can get information on a whole host of health and human service issues. We've had a really close partnership with the health department since our inception, but especially since March, and making sure that we're helping to transfer the current information that people need. We've been working on developing a closed loop referral system. So in addition to those open-ended referrals telling people where to go, we have another tool where the agencies that are participating can track and refer clients back and forth. And so we're using that software for this program, which allows us in real time to coordinate enrollment from multiple clinic sites. And so what we're doing as the patients are deemed eligible at that 10-day mark, we are then collecting those names, and we have contracted with a debit card vendor, if you will, who is going to be mailing out these stipends in the form of a debit card to the eligible participants. And so we've been working very closely with the health clinic systems, and when the patients are marked as eligible, having successfully isolated for that 10-day period, we are starting to process the cards. So last night actually was our first batch. So we had 45 people who have completed their isolation and will be receiving this cash relief. And again, I think there's a couple of purposes. I mean, one is to incentivize people to stay home and not transmit COVID. And then two, it's helping to answer that very serious economic impact that we know is being had in some of our most vulnerable populations. So we're really proud to be able to help in this way. There is a virtual cash card option as well, but what we're finding so far is that people are opting for the physical cards.
That is terrific news. It's great to see that this is rolling out. Before we move on, is there anything else you'd like to add to that before we move on to our next topic? And if you would stay on the line in case we have any questions.
I just want to say that the dates for this pilot program go through the end of the month. So the last people to qualify for this first bit of funding will be identified or started into the program by December 30th. And but given our increasing coordination around these needs, I'm hoping that we'll be able to continue it. But that first program is just through the 30th.
Terrific. Thank you. Thank you both very much. And then now we're going to move on to an update from our Environmental Health Bureau of the Monterey County Health Department. We've had Rick Encarnacion on before. He's the Assistant Bureau Chief, and he's going to give an update on some compliance issues. Hi, Rick.
Hey, thank you, Mia. Good afternoon, everybody. Rick Encarnacion, Assistant Bureau Chief for the Environmental Health Bureau. I'm here to give you an update on the Environmental Health Bureau's enforcement activities related to COVID, specifically with the food facilities that we are in charge of providing regulatory oversight, restaurants, markets, and any other retail food facility in the county. To date, we have conducted 1,971 visits to businesses, of that which resulted in 12 citations to 7 different businesses on different days. These also include notices of violations. Notices of violations could result in permit suspensions. And ultimately, if there's non-compliance to the permit suspension, the revocation of a permit. Of the notices of violations that we've had issued to several food facilities, many of them have come back into compliance and continue to be as we conduct our regular and unscheduled visits to the facilities. We have had a result of 1 permit revocation. Aloha Coffee and Cafe, Aloha Cafe and Coffee, we have revoked their permit. And we have also issued yesterday a notice of violation to the Tuck Box. We are also in coordination with the DA's office on following up on enforcement activities. And again, enforcement activities through the Environmental Health Bureau for restaurants and markets is nothing new. We are the health inspectors for the county. We conduct regular food safety inspections, food safety and safety inspections, and public health inspections. This is no different from what we consider any other agent that could cause disease or illness. And as the regular enforcement agency for restaurants and markets, we're following through. So if there's any questions on the responsibilities for food facilities, that is through the Environmental Health Bureau. And there have been some questions as to what the responsibilities are for food facilities. We have conducted multiple outreaches. There is so much information available, not just through the Environmental Health Bureau, but through the state and online. And right now we're following through on ensuring that restaurants and markets also participate, which I'd like to say the majority of the businesses are really trying hard on complying. It's just the few that if they decide to not comply, we are compelled to follow through on the status of that health permit.
Thank you very much, Rick. And I know there will be questions, so if you'd stay on the line.
Sure.
We have one more presenter. We have Dr. Moreno on the line today. He's going to give us an update on all things related to vaccine measures and metrics, and we're always pleased to have him on a media briefing. Hi, Dr. Moreno.
Morning, ma'am. Thank you for having me today. I would like to really focus today on vaccine. I can just summarize, let people know, though, that we still have a large number of cases due to ongoing transmission here in Monterey County. But what we're spending more time on these days is on working on the vaccine allocations coming into Monterey County and distributing vaccine and getting people vaccinated. We're aware of the recommendations for the different groups of individuals that are to be vaccinated, and the priority group right now is what's still referred to as phase 1A, and those are healthcare workers, healthcare personnel, and long-term care facility personnel and residents. And so we have been able to, we approved and the hospital received their allocation of distribution of vaccines, and they're in the process of vaccinating, and they should be receiving, and hopefully some of them may have received the Moderna vaccine. So they are SVMH, NMC, and CHOMP should all have some Pfizer vaccine and some Moderna vaccine. And Memorial will have the Moderna vaccine. In total, counting the allocation request that we'll make today or tomorrow, Monterey County will have to date an allocation totaling 12,550 vaccines. That includes both the Moderna and the Pfizer vaccine. So the hospitals are working to get the priority staffers vaccinated, each of their respective organizations. As far as the long-term care facilities, the earliest first clinic that I'm aware of is December 29th, and the pharmacy companies will be scheduling the first visits to the skilled nursing facilities, and we also we believe that in addition to skilled nursing facilities, there's some other long-term care facilities that the State Department of Social Services signed up for the pharmacy partnership program as well. And so several of our long-term care facilities are planning for that first visit, and 3 to 4 weeks after that first visit and vaccination, staff will be, the pharmacy will return to the facility and provide a second dose and a first dose at that visit if someone missed their first dose at the first visit. And then the third visit will also be 3 to 4 weeks afterwards to make sure that everyone that was vaccinated once gets their second vaccine. So that's underway. Hopefully shortly, we'll be having our first vaccines at our skilled nursing facilities before the end of the year. And we also have guidance on the next group of and within that, so those are the two large groups of healthcare workers that are getting vaccinated and will be getting vaccinated. There's also our paramedics, our EMTs, and in our fire departments, and currently our medical health operations area coordinator for the county is in communication with Monterey Fire, Salinas Fire, and AMR to attempt to finalize strategies to get the paramedics and EMTs in our county vaccinated. And so that is also in the works. And then finally, our dialysis centers, our folks in our team are reaching out to the dialysis centers because they're in tier 1 of phase 1A to receive the vaccine. So fortunately, dialysis centers do have medical staff that can vaccinate. And so we'll be working with them to make arrangements for vaccine to be made available to them so they can vaccinate them, their staff. And it's very important that they get vaccinated so that they don't get COVID-19 and potentially transmit it to their clients, many of whom are immune compromised. So that's what's in the works for tier 1. And tier 2 includes additional type of long-term care facilities, in-home supportive services, community health workers, like including promotoras, any of our public health field staff that are not working from home and are not in the office and are actually out engaged with clients. They would also receive it when we get to tier 2. And also very importantly in tier 2, our primary care clinics, such as our FQHCs, so it'd be like Soledad Medical Clinic, Clinic de Salud, and our own county clinics, in addition to correctional facility clinics and urgent care clinics in the county, would then begin to be able to vaccinate their staff. And it's going to be particularly important for our primary care clinics to get vaccinated, because we really want them to, because they have a large number of vaccinators. They have medical assistants and nurses and other medical staff that can vaccinate the community. And so as soon as we can get into tier 2 and get them vaccinated, they can begin to develop their immunity to the virus and be protected for when they start vaccinating our community residents. So that'll be in tier 2. And we also have tier 3, which will follow. And those are any other healthcare workers that weren't vaccinated in the first 2 tiers, which include specialty clinics, people who work in laboratories, people who work in dental offices, and people who work in pharmacies that weren't previously immunized. And when that's done, we can then move on to phase 1B, which is frontline workers. But it also now includes people older than 75 years of age. So the 65 and older was actually further down in the priority groups, but 75 and older is now included in 1B with frontline essential workers. And a lot of people want to know, what's an essential worker. So the current guidance is that there's frontline essential workers, and then there's the remaining essential workers. So frontline essential workers include first responders like firefighters, police, educators, people engaged in food and agriculture, manufacturing, corrections workers, U.S. Postal Service workers, public transit workers, and grocery store workers. And then the next group will be the remaining essential workers in our county. So with that, I just want to let folks know that we are working on developing plans to get each of these groups vaccinated. And again, we have 12,550 doses allocated thus far to Monterey County. And we also have the pharmacy retail partnership, which will be coming to long-term care facilities to vaccinate staff and residents. So that hopefully will begin before the end of the year. And then finally, we do recognize that as distributions go out to various healthcare facilities and other organizations, we have the possibility of them not receiving enough vaccine, which we can probably redistribute, but some of these facilities might have vaccine left over, and we don't want that to go to waste. So we are also, are in the process of completing paperwork that to get approval to redistribute vaccine within our jurisdiction, to make sure that vaccine that's not going to be used and is still hasn't expired gets to organizations that need to get staff or certain priority populations vaccinated. So we're working on that as well to make the best use of the vaccine here in Monterey County. So that's my update for today.
Thank you very much, Dr. Moreno. And we've already got some questions that have come in, so we're going to go ahead and get started. And the first question is for you, Dr. Moreno. Is the stay-at-home order that was imposed on December 9th working to reduce infections in Monterey County? And how does the health department determine if the order has been effective, given the what are described as skewed infection data posted on the county website? Similarly, when will the data reflect the true numbers of new infections in the county?
Okay.
And I can repeat that if you'd like.
You'll have to repeat that. So I'll start with the last question. So as far as the data that goes on the website, the data that goes on the website has always reflected the number of cases that we report out on a daily basis. It's never reflected the actual number of people who got sick on that day, and the reason is because as the numbers get reported to us and we confirm them, they get posted to the website, and then our case investigators will go in and look at the onset of symptoms or the testing date, which is different than the date we post. And so then those cases get reassigned to the appropriate date, and that gets spread out over the graph over the following days. So it's so if we have for example, we had I think 3,300 and then 1,000 cases. Those weren't the number of cases those weren't the days that people got sick. Those are just the days that they're reported out. So what we're really looking at is the trend. We're not looking at a day-to-day. That's not how we use in public health, how we use the data. We're really looking at the trends. And right now the trend is that the cases continue to increase. And so what we really are trying to do is with working with Krista and Rosemary in the community is to try to get people to understand that the stay-at-home order is basically requiring that people stay home and not gather with other people that are from other households. That's how this that's how this virus is spreading. So if anybody has any concern that about how severe this we are at this stage of the pandemic, you can definitely look at our graphs. It's on our website, but we also need to look at and continue to hear from our hospitals. Our hospitals are telling us that they're full, and so I really urge people to stay home and not mix with other people from other households. What was the other part of the question?
I was just going to add in, is the stay-at-home order working to reduce infections in Monterey County?
Oh, yeah. So we do know that when there are restrictions in place that limit the opportunities for people from different households to gather, that there is a reduction in transmission. However, we believe what we're seeing now is people still gathering, private gatherings, and that's where, and then getting infected and then bringing the virus into the household. So the stay-at-home order is effective, but it's only as effective as people follow the guidance and avoid mingling with people from other households. And was there another part to that question?
I think you covered. I think you got them all.
Okay.
So and the next in the chat there, Rosemary Soto has put in some information about the community groups that are working on the community-based health workers, and that is in the chat for people who would like to know what groups are involved. So then moving on, a question for you, Dr. Moreno. Have state officials informed the Monterey County Health Department whether the Bay Area region stay-at-home order will be extended past January 11th?
I don't know that I've been that the state has informed me that it's going to go longer than 3 weeks. So my order does end is scheduled to end in January, but the state stay-home order took effect shortly after mine, and so the plan is that they will look at the projections for us for this region when we get close to 3 weeks from the time that the state put us on the stay-home order, and they will look out approximately 4 weeks to determine whether or not we would they predict that our trends will improve and our ICU availability will get above 15%. So we're looking for that. I'm checking my emails to see if that's coming up, but I haven't seen anything yet from the state.
All right, thank you. Our next questions are for Rick and Carnacion. Rick, were the 1,971 visits since the latest stay-at-home order, or were they video visits?
The 1,979 visits were conducted since September, since the county passed the urgency ordinance relating mask coverings to our citation process. They weren't done by video. We have people in the field. We also have on-call staff that could respond to after hours. Just to let everybody know, we are responding to complaints and information that people provide to us, and we verify it in the field. Again, this is no different from what we do with complaints like roaches, rats in food facilities, no hot water. The processes that we are applying now are the same. We have the authority to conduct inspections as well as assess the health permit status, which is issued by the Environmental Health Bureau locally.
All right, and then again, another question for you. What was the, I'm going to break this one up because there's a couple questions, so I'm going to break it up. What was the violation at the tuck box, and what is the potential penalty?
The violation at the tuck box was being not compliant with the COVID requirements, specifically allowing outdoor dining. Again, this requirement has been made clear statewide, and we are not, we really don't have any more tolerance for non-compliance with any orders, and we're taking swift action, which includes potential penalties, which are pretty swift, like an immediate suspension of the permit, which is allowed in the regular code that we apply again for when we do our health inspections for restaurants and markets and any food facility, an immediate suspension of activity. And if they are not compliant with that permit suspension, it could be considered an immediate hazard, a public health nuisance, and could be evidence towards what would be a permanent revocation of the health permit, which is required again to operate, which I'm also sure is probably required for some of their insurance requirements. So the potential penalties not only include recovery of costs that the health department has to do in multiple visits to the facility, where we could be doing other good work for people that are complying. Fines related to the current and existing citation process, which could be up to $1,000 per day. So there are pretty heavy fines for simple compliance and these measures. And I think Dr. Moreno, he pretty much communicated the gravity of the situation. And again, in what we do for restaurants and markets, just like what we've done in response to E. coli outbreaks, salmonella outbreaks, norovirus outbreaks, there's a sense of urgency, which again, the Environmental Bureau will take swift action for food facilities and any other business that has a health permit to follow through.
Thank you. And then here's the other half of that question, and I think you actually answered this earlier, but I'm going to go ahead and ask it again, and if you want to add to it. How were you able to revoke the permit for Aloha Coffee? Isn't that in the city of Monterey's jurisdiction?
All food facilities in the county of Monterey, north, south, east, and west, are regulated by the Environmental Health Bureau. The health permits that are issued that are required by a county code to operate through the health officer are issued through the Environmental Health Bureau. I'm pretty sure for the cities, a working operational health permit through the county health department is also a requirement for the specific cities to allow businesses to operate in specific cities like the city of Monterey, which we are coordinating with the city of Monterey to follow through with Aloha Cafe Coffee.
Thank you. And then Dr. Moreno, a question for you. Is the list of skilled nursing facilities and long-term care facilities on the pharmacy program available? Can you share that list?
I don't know if it's available. All I know is that the Department of Social Services, we were informed that Department of Social Services signed up a number of their licensed facilities. I'm more familiar with the California Department of Public Health side for licensing certification, less so familiar with the Department of Social Services side of things, which license other types of residential facilities. But there might be something on the state website that has that would show that list.
All right, thank you. Another question for you, Dr. Moreno. When is the next vaccine allocation request going to be made?
Oh, we're going to be making that request either today or tomorrow.
All right. And then, Rick, going back to you, what kind of additional enforcement does County Health recommend under the latest COVID-19 order? Well, this could be either for Rick or for Dr. Moreno.
With respects to the Environmental Health Bureau, we issue health permits for a variety of businesses, not just restaurants and markets. Locally, we have permits for hazmat facilities, body art facilities, so on and so forth. So with that respects, it's the normal routine enforcement that we have, where we gather evidence of non-compliance and we take it to a hearing. We also have the authority to also apply immediate permit suspension for issues that are related to immediate danger to life or health, which this is, which again means immediate suspension means if we order you to cease and desist, you have to follow it. Again, it's nothing new for what we do with roaches, rats, or mice, or any other sanitation or public health issue related to a business that's regulated by the health department. Another thing that we could do in addition is with respects to private gatherings. If there is a business that is catering to a private gathering, like a mobile food facility or a caterer, they could also be found in violation, and we can take the same processes that we do for brick and mortar facilities.
Right, thank you. And then Dr. Moreno, here's a question for you. Looking at the data, it appears those who are aged 0 to 17 are seeing case totals double this month compared to all months prior to the start of the pandemic. Do you know the severity of these cases and if they are tied to holiday gatherings?
So yeah, thanks. So as we've moved through this pandemic, there's a lot of things that have been happening. And initially, we have, when we initiated testing, we brought in, or the state brought in 2 OptumServe sites they're now in Salinas and Seaside. And those sites were not testing children. And similarly, many of our clinics were testing mostly symptomatic adults because adults tend to have more symptoms and have worse disease due to COVID. And so for some time, we were seeing mostly testing among adults. So now we have more testing of children at a variety of testing locations, and some of our clinics, our family practice and pediatric clinics are now testing children more than they were before, particularly if a family, for example, comes to a clinic and they're going to be swabbed outdoors outside the clinic. Sometimes there are several children in the car. the clinicians will sometimes take advantage of the opportunity and swab all the children in the car. So part of the increase, I believe, is due to an increase in testing among that age group. So the more we test in a particular age group, the more we'll find. So I think that's the main contributor to this. I don't believe that that children are experiencing worsening symptoms. From what I hear from clinicians, the children tend to have mild to little to no symptoms very often when they do get diagnosed with COVID. And when we look at the locally, not just locally, but nationwide, we still see that the more severe illness is in our older adults and individuals with underlying medical conditions. So that's still what we're seeing, the worst morbidity.
All right, thank you. Back to you, Rick, for a question. Was the tuck box serving outdoors, or were they allowing people to use outdoor tables?
The notice of violation would have been for outdoor dining and serving for the food facility. I just want to clarify also, when we issue these notices, from our experience, it's not that this is an activity that is misunderstood or in question. Most of the violations that we see related to this are purely just in defiance of the orders that are understood by many, many people that are struggling right now. The defiance of the orders, they're not doing it behind closed doors. It is pretty brazen and upfront, which in turn we will respond to issuing the notices of violation, as it is a public health nuisance. The fate of their health permit to operate is in the operator's hands because, again, this is a public health urgency, and messaging of the urgency of this also includes the participation of these businesses that are regulated by the health department. That's why it's so urgent. Serving outdoors is not allowed at this time for businesses, for food facilities. Food facilities can do takeout and pickup. So again, the following of the health orders are pretty plain and clear. Continued non-defiance will result in a permit revocation if they're in defiance of a permit suspension.
Thank you. And then another question on the Aloha coffee. Why and when did the Aloha coffee permit get revoked, and what is the current status?
Through a series of visits, even starting months, and repeated complaints, there were issues with not complying with the mask ordinance. And again, after issuing a permit suspension, the facility remained open. Usually when the health department orders a food facility closed, like I already mentioned, if we find any health violations that are of significance, like for roaches, rats, or mice, and we order a closure, there's immediate compliance. In this case, there was no compliance. We were compelled to revoke the permit due to the gravity of the issue of it being a brazen defiance of a very important health order that really is about immediate danger to life or health of the public. Just to clarify, there have been some feedback and response for those who are in defiance of the order as if this is something new. It is not new. The health department, day in and day out, this is what we do especially for food facilities, to ensure that they understand and follow health orders. Following the health orders, there's always updates to the health orders. There's always new diseases on the forefront. So again, this is just something that people need to follow, and the ways that people can follow are pretty simple and straightforward. And people that do follow, the people that are following the orders, are the ones that we're sticking up for. For those that are just in defiance, again, we'll follow through.
And then part of the question was for the Aloha coffee, when did the permit get revoked? Do you have that at hand, or can we do a follow-up?
Again, we had the hearing last week, and then we had the judgment order today.
Okay, and then I'm not sure if you said specifically what the specific violations were for Aloha Coffee for revoking. Was it the mask and then continuing to operate?
Yes, it was for the initial notice of violations was not following and applying the mask orders, and then continuing to operate even when the permit was suspended. The health department did our best to inform the public of a suspended permit. Just FYI for everybody, whenever there's a health action, we do our best to inform the public. We're the same people that post warning signs on beaches. So we're trying to do our best to update the means that we can inform the public of who's in compliance and who's not. The health department does have a website and a food safety app that's available so people can see what the compliance status is of every business. In addition to that, we're also trying to develop a means for businesses to show that they are in compliance. So it's not just about the enforcement, but also the promotion of businesses that are complying, which is again the majority of businesses. The focus on the enforcement efforts, although they're a small number, they do contribute. It's a contribution to this mess that we're in. So that's why it's so important and urgent that the Environmental Health Bureau follow through on the businesses that are not compliant, especially the businesses that have a health permit.
All right, thank you. And then a question for Dr. Moreno. It's a follow-up question to the vaccine allocation request. After the request that is made today or tomorrow, when is the next request going to be made?
Thanks, Mia. So we've been told that the plan by the federal government and the state has been to provide allocations on a weekly basis. And so that's what as we are implementing our strategies, that we're going to be planning accordingly, and so we can get vaccine on a weekly basis to agencies that need to vaccinate their staff. And so, but the number of vaccines in the allocation have varied, and I don't have any estimates of how much we're going to get on regularly on a weekly basis, nor can I guarantee that we're actually going to get vaccines on a weekly basis. So we get informed on a weekly basis what the estimated allocation would be and the deadline for us to allocate, and then we look at the agencies that have yet to be vaccinated to receive vaccine and determine whether they can actually receive the allocation or distribution directly, or whether we'll have to make some arrangements to get vaccine to them accordingly. I think it's what I forgot to mention earlier, May, is that our hospitals, I did mention that our hospitals are beginning to vaccinate. What we'll be doing probably in 1 to 2 weeks is working with those hospitals to determine whether or not they need additional vaccine for the second doses. An individual is considered protected after they receive 2 doses, and I believe another 2 weeks after the second dose for the second dose to have full effect. And so we're looking at 5 to 6 weeks on the schedule as recommended, 5 to 6 weeks for our hospital workers to receive the full benefit of the 2 doses. So we're going to be that'll be the next, in a week or two, next step will be to make sure that our hospitals are to see if they need additional vaccine to get everyone that is eligible for a second dose and get them their second dose.
Thank you. And then one more follow-up question for you on the question about the children being tested. You had said most sites weren't testing children at first. When did the spike in testing start for children?
I think that's just a gradual progression over months. So there wasn't a particular day that providers across the county started testing children. It was just dependent on their level of comfort and availability of testing materials and protocols in place to test children.
All right, thank you. That's all the questions that I have in chat. I want to give folks a chance to ask, put in any last minute questions before we wrap up this briefing for 2020. Okay, that looks like all the questions that we have. I do want to take a minute because this is our last media briefing. It really has been an extraordinary year for all of us. And I really want to thank each and every one of you, our media partners, for all the hard work that you have been doing to educate the public about COVID-19. We really look at you as a partner in all this, and never has your role of informing the public been more important than it has been this year. We've also had to learn a lot of new ways to communicate this year, and it's really required flexibility, adaptability, and I really appreciate the journey that you have taken as we've all come together and learned how to communicate in this, in a new way to communicate in a really short amount of time. So thank you for all of your hard work, and hopefully better news coming in 2021. And now we've got Charles McKee on, who's going to give us the last word.
Well said, ma'am. I'm not sure I could add a lot of substance to what you've already articulated about the need for collaboration and cooperation here in Monterey County. And the media is a big part of getting out the message, and not just getting out just, kind of what we say, but also asking those tough questions and trying to dig in and get the information out that's important to their readers and their viewers, and getting it out in the way that they think is most appropriate. That the partnership is not just a one-way street of regurgitating what we say here as Monterey County government, but doing it in a way that is important as journalists. And we know that that's a key to having a vibrant society and a free society. So we appreciate the role that our media partners play in doing that. And on top of that is also the willingness to put out some of the public service announcements, public service messages that we know are so important. And as you do that, we would also appreciate you getting out there that message of how to give back and help others that may be struggling at this time of year, or maybe have lost someone, or maybe challenged overall by just the circumstances that they find themselves in. And it may be because of COVID, or it may just be the unlucky circumstances that they find themselves. And we who are lucky and have good fortune, we want to make sure that they have resources, and the media as an important partner in getting that message out. So I want to thank everybody who has been part of the efforts in 2020. They've certainly been more than challenging, and we look forward to 2021 and trying to get back to normal in 2021 and having an exceptional year coming forward. So peace and prosperity is my wish for everyone, and we will see you in 2021.
And with that ends the briefing. See you next year.